Hello, everyone. It's Dr. Jensen from Dean's Chat. If you're on the fence as to whether you want to join the American Podiatric Medical Association, jump on in. It's a new APMA. Whether it's advocacy concerns, scope of practice, billing and coding, consider membership at the APMA as your professional insurance.
Hello, everyone. Welcome back to Dean's Chat, where we discuss all things podiatric medicine and surgery. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the co-host for the Dean's Chat podcast. Once again, I'm joined by my co-host, Dr. Johanna Richey. Hi, Joe.
Hey, Jeff. How was your weekend?
My weekend was great. I was out of town a little last week traveling, so kind of recharged my battery a little bit. How about you?
Oh, it was outstanding. We are getting ready to go to the Western. So literally yesterday was the span of all my kids' clothes. After that, we're going to go on a vacation, which is fabulous. But there's 12, 13 days that all of a sudden I was like, this is a lot of strategic planning. How are we going to pack all these things? So that was a fun bonus for the weekend, is figuring out the logistics of being gone for a somewhat expanded stretch of time.
That's great. Joe, we have a phenomenal guest today. I would like to introduce Elizabeth Piselli to Dean's Chat. Welcome, Dr. Piselli.
Thank you for having me, Dr. Jensen, Dr. Richey.
It's our pleasure. Thank you for carving out the time. We're fairly informal on Dean's Chat. And if it's okay with you, let's go first names. You said Liz is best. Liz, Joe, and Jeff.
Sounds great.
Well, thank you so much, Liz. It was such a treat to meet you last year at the APMA National. And since I've kind of gotten to know you and I've been following some of the content that you've put out, I really wanted to have the opportunity to pick your brain. You're currently the president of the American Association of Women Podiatrists. And that was an organization that was very close to my heart, certainly as a student club leader. But you're also currently the owner of Balance Podiatry. I'd love to start with your undergraduate experience, because you and I share a love for the arts. And you were a student, you went to Stanford University and got your Bachelor's of Arts in American Studies, focused on American art and literature, but you were also a lacrosse player. So I'd love to hear a little bit about how did you find podiatry and what was it like to study at Stanford?
Oh, wow. Yeah. So a lot there. It was absolutely wonderful to study at Stanford, and lacrosse is what brought me out there. So lacrosse, I was the beneficiary of Title IX. So a lot of these schools with bigger football programs, bigger basketball programs were expanding their women's sports. So one of the things that they were looking at was lacrosse scholarships. So that was fantastic. I don't think my parents would have let me go 3,000 miles away. I'm from Long Island originally, and here again. So I don't think they would have let me go that far without that scholarship benefit. So that was absolutely tremendous. You get on campus and they say with their official visits, I'm not sure if you're familiar with recruiting in college sports, but they had, when I was doing it, they had official visits and they would say, as soon as they get you onto campus, they might as well just have you sign. And it was true. It's like these beautiful palm trees. And I was coming from Drury, New York, and looking at only East Coast schools. So it was like a no-brainer. So that was my journey to Stanford. And then having that art background and always being sport related, my family sort of pushed me into, they said, you would be a really good surgeon because you're interested in art and you care about sports and you care about, just keeping your body healthy and all of that. And I was kind of expected to go into medicine, and I'm sure other people have experienced that. So I actually shadowed all these different doctors, and I was pretty squeamish actually. So at a few different doctor visits, I'd be like pumping the calves, and then found podiatry to just be so interesting, not even realizing it was a separate school. My podiatrist was the kindest. He was talking to all different people, and that sort of helped my my need for stimulation at all times. Is that those 15 minutes appointments where you really felt like you connected to so many people at once, whether it was a young kid, an older kid, people that were hurt, people that you just needed to get moving again, people in tears because you tear down a callus as small as that. Now they could walk pain free. I mean, I just loved the immediacy of it, of the effect of that specialty. So that's what drove me to podiatry. But with the trimester system, or they call it the quarter system at Stanford, most of the sciences had classes on Fridays. And because we were traveling to the East Coast, a lot just get ranked basically because all of the good teams were on the East Coast. We had to fly Fridays, terrible times because, we didn't have a great budget. We were still just women's lacrosse. And so I would have to miss a third of the classes. So I had to pick a class or a major, one that interested me, but two that had papers instead of tests. So things where I could just do stuff on the road. At least that's what worked for me. I mean, we had plenty of engineers and science majors on our team. I just couldn't do it, not being in class. So that's why I ended up picking American Studies and then, following my interest to arts and literature. And then I would have to take a lot of the sciences either in the winters or summers outside of school, and then actually finished a lot of my sciences after. But to that point is that because I wasn't taking a lot of sciences, I'm like, there was a turning point where I said, I don't even know if I want to still do medicine. Maybe I'll look into like museum curating or, teaching or that sort of thing. So there was a crossroads my senior year that then I ended up switching to podiatry, full focus, full enthusiasm, full steam ahead.
What was it that really kind of sealed the deal for you?
So there was this small website that was only available to college kids at the time. It was called thefacebook.com. And my friend had gotten me an interview and I was going to be in HR, and they didn't have a lot of money, but they had snacks and they would pay me for my commute and they would pay me in stuff. And my dad said, absolutely not. He goes, these websites don't go anywhere. It's like MySpace, but worse, which I'm sure anybody listening now is like, what is MySpace? So I was like, okay. And he said, if it were your brothers, I would let them go. But podiatry was always the plan. Come back for a year and you can always go back to it. And so once he got me back to New York, I had gotten a job as a college lacrosse coach, as an assistant coach, and then just finished all my sciences. And then Facebook took off. And then I made my dad watch the Social Network movie next to me, just to drive that point home that the Facebook went nowhere. So that was what ultimately pivoted me, was my dad just saying, podiatry was your plan, just come home for a year, and that was it.
Wow. Oh, I love that. Jeff, what are your thoughts?
So I'd like to ask you a few more questions about your time at Stanford.
Sure.
American literature, I love it. Who's your favorite author?
Oh, yeah, in reality, or do you want me to say like my intellectual favorite?
Both.
Yeah, both.
Okay, so I would love to say Joseph Heller for like Catch-22 and that absurdity humor, but in reality, it's probably like Ellen Hildebrand or Leanne Moriarty. I don't read anything ever since I had kids. I don't read anything that's too emotionally draining. I like to just distract my brain, live in someone else's brain for a little bit, and go from there. So right at this moment, yeah, even Emily Henry, probably my number one, but she didn't put out anything this year, but yeah. So as far as Mark Twain, if we're talking about like more intellectual and what I wrote a lot of papers on, a lot of Mark Twain in there.
How about John Steinbeck?
Not as much, but yes, did read John Steinbeck, but yeah, he wasn't one of my favorites.
Okay,
Was he one of yours?
I've read almost everything he did. At different times, Grapes of Wrath was great. East of Eden, Of Mice and Men. There's a bunch of good ones.
Of course. And then what's nice about it is they're usually short. So it was nice to write papers.
Yeah.
John.
Oh, for sure.
Yeah.
And then, Joe, if you don't mind, I'll have an add-on question. So while you're doing all this and you're traveling and you're reading, you're writing, you made the U19 Team USA for lacrosse. What was it like to represent the country?
Oh, it was pretty incredible, but I didn't have the language for it then, but imposter syndrome definitely came into play there, because I remember even cheering for the team and not saying go USA, but instead like go blue. So that was an interesting phenomenon. And then it was actually the one year that they didn't travel abroad. They were just at Towson, Maryland. So, I didn't get to go anywhere fun. So I was on the squad of 24. And then for international play, they had to bring it down to 16. So I didn't make it for that, but I was basically like the team manager. But the benefit of being in Maryland was it was no problem to take me. They didn't have to eliminate that. But the problem was I couldn't be one of the few to go. Like one year they went to Japan, Scotland, Australia. So I didn't get to go anywhere fun, but it was still fantastic. And I have the jersey frame, but it was one of those crazy experiences where I first experienced that imposter syndrome. Like, oh my goodness, I worked so hard. I dreamed of trying out and dreamed of be wearing red, white, and blue. But when it actually came to fruition, it was very surreal, strange experience.
Oh my gosh, how interesting. Yeah, Joe and I interviewed an Olympian a couple summers ago, Derek Mine, and he had been in the Olympics twice. Once was during COVID, so we didn't really get to go and got delayed. And I mean, those are quite the story. So congratulations. Oh, what an awesome opportunity to represent our country.
Thank you. It was.
I'd love to piggyback off of that actually, because imposter syndrome is something that we've been talking a little more regularly about. Looking back, knowing what you know now, what might you have told your younger self or done differently to help you in that moment of feeling that imposter syndrome?
Oh, that's an excellent question because I'm not sure. Because I'm not sure I haven't figured out now, even. I think it would be easy to tell myself relax and just enjoy it, but I don't even think I could transport my 41-year-old self back then and be able to say that because I don't, we experience it now. So it's easy for me to say, hey, kid, just enjoy. But then I feel like that 18-year-old would be able to look at me and say, okay, you do the same. So I'm not sure. So if you guys have any advice, I would take it, please.
I find imposter syndrome so incredibly fascinating because it's the kind of thing that certainly I carried around. I still carry it around. I have not lost it, but I am better at talking myself down from the ledge of imposter syndrome. But the more we've talked to different people, and some that I would have never expected for them to use the terms like, oh yeah, imposter syndrome. I'm like, you too, you of all people could have that. So it helps, I think, in my own mind to recognize like, oh, there she is. There's my little imposter syndrome. Just like Derek Mine, the Olympian, what was like ranked number 2, number 1. I mean, like incredible, accomplished people. Lyndon Mason, the orthopedist from the UK, who is incredibly well published. Like to hear these other people that I hold in high regard carrying that same moment, it helps me connect to the human part of it. Like this is a normal human experience. It doesn't mean everyone experiences it the same way, but just being able to like have that like, oh, there she is. Yeah. Hi. Okay. Thank you for your feedback. Right. Like you can go sit in the corner. Like one of the things that I think it was Rachel Gerber had said to me at one point that I thought was really profound was I would, how would I describe myself for a job? Like if I was hiring myself, would I hire myself? Like, here's my qualifications. And as you start like listing, it's also like, yeah, I am capable of that. But I would not say, or even begin to pretend like it's an easy experience, but just that like identifying, oh, there she is. Yeah. Hi. Yeah. I see you. Thank you for showing up again today. What are your thoughts, Jeff? Do you deal with imposter syndrome, Jeff?
I think we all do at different levels.
Yeah.
I mean, I had it bad in college. I was like, okay, I'm taking physics and chemistry, and I didn't do this in high school. And can I do this? I don't know if I can do it. That kind of thing.
Yeah.
Even podiatry school, overwhelmed at times. We'd come out of it. You know how classes congregate and they talk about questions on the exam. I had to stay away from that because people would come out of the test and go, oh yeah, it was just like a review from undergrad. And I'm thinking, oh my goodness, that was all new material to me. And when it came to residency pursuit or anything, I mean, everybody's got self-doubts. I mean, nobody's got all the answers. And I think it's inevitable that we all have a little element of imposter syndrome.
I think it also can drive you, right? I think we're all high achievers, right? We're all people that want to achieve more, right? Nobody feels comfortable and stagnant. And it's almost like an evolutionary advantage to have that, right? To want to achieve more. I remember my favorite Michelangelo quote is, Lord grant that I aspire to be more than I accomplish. So you always want to be more. So then there's the turn of that where then you never feel like enough, right? So I don't think you're ever going to feel like, oh, I've made it, or, rest on the laurels. So in one way, it really served me. Like my dad would laugh and say, I was very well balanced. I have a chip on both shoulders. That feeling that you have something to prove is sometimes great, and it can really drive you and bring you to where you two, are. And then at the same time, it's a voice that can sometimes be detrimental and not serve you. So it's just realizing when it works and when it doesn't. Something that worked for me when I first started, and I think this is relevant, is Liz can't do this, but maybe Dr. Piselli could. And I would literally put on my glasses, because I usually wore contacts, and I would put on my glasses to go into the clinic to say, like, well, Dr. Piselli can do this, but Liz can't. So it was like almost putting on a persona. And I heard that's what actors do as well. It's like, just wearing a prop makes you feel like, all right, well, this person can do it. Like this side of me can. So I don't know. That helped in the beginning a little bit.
I was actually, this weekend, I was reading an article about, it was a wellness article in like the Real Simple magazine, which I love. Real Simple, non-paid advertisement. Probably not a shock to anybody that listens to me on a regular basis. But anyway, even just using your own self-talk of using the word you, like you can do hard things, Johanna, like versus I can do hard, just the word you changes the way that your brain perceives that piece of input. It was fascinating. Again, it's the stuff that, like, I am not a psychology major, but I will take any competitive advantage I can get sometimes. And raising two daughters, it's also, as I watch them go through things, like, how do I frame this for them in a way that like my 10-year-old, bless her heart, she just like broke down and she was just like, I'm feeling really overwhelmed. And I was like, I was so proud. I'm like, good job for labeling your emotions. She thought I was ridiculous, right? But like, there are grownups that can't do these things. So helping figure out, how do we frame this in a way? And I loved what you said about it does help you. It is a competitive advantage to own that and say, I constantly want to be better. But the flip side to that coin is you may never then feel enough. And I really had never thought of it as that like dichotomy of perspectives or paradox. I'm like, what's the other word? It's a paradox, really. So I thought that was really insightful, actually, Liz. Yeah.
Joe, also, I mean, sometimes, and Liz, the chip on your shoulder doesn't come from within, it comes from outside. I had people tell me when I first applied for NIH grants, you can't get those, you're a podiatrist. And it didn't even dawn on me. I wrote the grants to the best of my ability. Next thing you know, you get 10 of them, right? Mm-hmm. Or patents, or, infiltrating a medical device and inventing something that can go, viral in the medical device space. I mean, everybody says, oh, you can't do that. You can't do that. And when it happens, it's like, well, I guess we can, So some of it's externally driven. And
yes.
And I think, I don't know, you just got to kind of get your arms around that. And I think it's good to have a chip on your shoulder, Liz. I mean, otherwise, how are you going to accomplish stuff that it's hard to do,
Yeah.
Great stories. Great conversation.
So it's also helpful. So you were from the New York area originally, moved to the other coast to go to undergrad, moved back then to go to the New York College of Podiatric Medicine, completed your 3-year surgical residency program with, is it Montefiore Medical Center?
Yeah, Montefiore.
And you were the chief resident there. Yeah. And then you went on you've been in practice now for over a decade. Tell us a little bit about where your interest for sports medicine, obviously you were an athlete yourself, but in your training, were these, did you find opportunities to explore and develop that? Or was that really kind of additional passion that developed outside of residency?
That's a great question. So I think there was a little bit of an expectation that I would go to through sports medicine from my family members. Like, to them, this pathway ended up being inevitable, but for me, it wasn't. I think in residency, you're so surgery focused, getting your numbers, that I was like, oh, I'm going to be so surgical. This is ridiculous, which is funny because when my first bunion I had ever seen, they snuck me in as a student. And I passed out, and I was in recovery with the patient. So this is someone that is that squeamish. Yeah. So the fact that I was then so enthusiastic about surgery in residency was also surprising. And then when I got out, I was in my area, it's just a suburban area, and no one wanted to take off time from their work to do surgery. So I was like, well, what about my numbers? Like, you guys are not helping this whole thing that I have in my head, this whole plan. So, and I knew this is a place I wanted to practice because it's where I grew up and where I wanted to live and all that. So that piece of the puzzle was very clear to me. So I was thinking, if geographically this is where I am, and this is the people like my family members that I would want to then serve, I've got to sort of adjust how I do things, which ended up being more non-surgical. And I found that athletes were drawn to me, one, because of my resume and, the bio you put up online and all of that. But just being able to speak the language of the athletes, like understanding how devastating, because someone can say they're sports medicine, but not truly understand how devastating it can be to not be able to do your sport, and how many people you feel like you're letting down if you're unable to do it. So I am definitely very aggressive with keeping people playing, just because I know the mental tax it is to not be playing, or at least not be moving. I know I am a beast to be around if I'm not moving. Like, it's something I've realized, like, why am I so miserable? Oh, it's because you haven't done X, Y, and Z. And I'm not, as crazy as I'm saying crazy, but you know, as athletically inclined as I used to be. But it's like, just moving is really important to me. And I know for most people it is, just to be able to recognize that. So I think parents finding me through the lacrosse network and through lacrosse world, and because I still had a name that people recognized in my area from my brothers playing sports, my parents, my dad and his brothers playing. So I kept my maiden name for that reason, for brand recognition, really. But also just being able to speak the language, understand the psychology behind it, really understand the mentality, and that real feeling of, I want to say, like, yes, it can be depression when people get injured, when they're used to moving and they really tie their identity to movement and to the way they can move, and not being able to, even if it's just, the recreational runner. It can be really validating to have someone that understands that. And I think that's why it found me, because then my word of mouth seemed to be that, yes, you get, your general podiatry, but I found my word of mouth referrals were all people that had that similar feeling.
Dean's Chat is headed to the National in Nashville in just a couple months. Jeff, are you excited?
Oh, I'm very excited. We'll be there on August 7th. We'll be at the APMA National Meeting. It's kind of the Pod Expo we'll be involved with. Hopefully, if you're there, you'll come by and say hi to us.
Yeah, last year was so much fun. It was we had some scheduled interviews. We had people walk up and be part of the community, and it's wonderful to connect with people in that organic and natural way there in the expo hall.
Absolutely. It's always fun to catch up with our colleagues. And last year, I thought it was one of the highlights of the meeting. So I'm really looking forward to it. So if you have not registered yet, go to www.apma.org/the national. And we encourage you to be there, and hope you can drop by. And we'll even do a little interview if you want, and put you on Dean's Chat.
Yeah, the fun little snippets. We love to, but even if you don't want to be on and you just want to come say hi, we love to engage with the audience and connect.
Absolutely. Bye now.
Cheers, everyone. Yeah, and to your point, movement is life. I think that's why all of us at some point resonate so much with podiatry, because our goal is to keep people doing the things they love doing. And there's a lot of ways that we can do that. I'd love to get, actually, before I transition, Jeff, did you have anything else before I move adjacent to sports medicine? It's still in that.
Yeah, no, it's all right. So Elizabeth, when athletes come to you and they sit down and they talk to you and they understand you're an athlete and you understand them, are they more prone to be compliant with your instructions because of that connection?
I'd like to believe that, but I think I often then note, I think I'm quicker to realize when they're not compliant, and because I'm like, no, you're lying to me. I know you're lying. I can see that you've been lying. I'd like to believe that. I also think that because it feels like a partnership with them, and sometimes there's certain people you're not going to be able to ground. And I'm like, all right, well, then let's compromise. Do you think you can just do like 1 mile a day, instead of the normal 10 or something? I think because of my understanding, then feeds more of a partnership. So maybe I'd like to believe it's that, or it could be that I'm willing to compromise. So that's a good question. I'm not sure. I'd like to believe that they'd hear more strictly to my guidelines, but I don't know that that's true.
It's interesting because we go from doctor to being the patient, and Joe knows this story. I had surgery on my knee last year, and it incapacitated me for some time, and I was going places, and I had to be wheelchaired at the airport, and I was watching people walking around. I'm like, oh my God, I was like, this one clinician coined it knee envy, because I had like, oh my God, I used to walk like that. And it took a while to get back. But it helps to have an empathetic doctor and realize that it's not forever, right? And it's going to get better. So anyways, that was my sidebar, Joe.
No, I love this because I actually very much do think that they do listen better. And I teach the students the number one reason that patients don't do what you ask them to do is not that they're arrogant and difficult to work with. They just disagree with you. They don't understand the why. So if you're not an athlete and you're getting this doctor that says, well, you just can't run, and they're like, that's just not an option, they're going to figure it out. Whether you gave them the permission or not, they are going to figure. And I think you and I love runners and I hate runners all at the same time because they are impossible to stop, right? Yeah. So to that point, I loved the word partner that you used there because I feel like, especially in the day and age where patients come in very well informed about different injuries and they're maybe not 100% right on the diagnosis, but they can get pretty close. So they've already done a lot of the home care things that they could figure out. That's not why they're there. They're here to see you because they're like, look, I don't have your expertise. I am going to keep running. What I need to know is when am I going to really hurt it? When am I going to need a surgery? And what are my alternatives to just doing what I'm already doing? And so when you can partner with them, as you had said, I think they instantly feel like this is someone who sees me, who has lived the version of a life that I am wanting to live, and will understand what that actually means. And so I do think that they listen better. It doesn't mean they're going to be perfect, right? We're all human. We're all going to be humans. I'm a terrible patient and I know just enough to be dangerous to myself, right? But like, you just do the best you can sometimes with what you're given. And, but I really liked your word partner. And maybe that's a good kind of segue into, you've also done professional work as the podiatrist for the New York Lizards major lacrosse team. Can you talk a little bit about when you're treating more in a professional capacity, how is that mindset a little bit different than like a, 10-year-old sporting team?
Yes. So that was with actually my first job and they had thrown us into that and felt like being thrown into the wolves because you're going into private practice for the first time, which is entirely different. Because I had done my residency in the Bronx, which is a very urban area, and now you're switching to private practice, which is totally different mindset, totally different goals, really. And then they were also throwing us into, all right, here's some professional athletes, and a lot of these. So Major League Lacrosse at the time, now there's the PLL, which is an entirely different league. Now they get paid by the league enough where they could just do that. But Major League Lacrosse, they still had to, reminds me of Major League Baseball back in like the 20s. Like they still had to have a job. So they were, it was kind of a weekend warrior on steroids. So like they didn't have the time to train the way they used to in college, but they were still expected to play at these high speeds. So it was a very strange experience where I wouldn't maybe necessarily treat things the way I would like long term, but it was like, hey, listen, I need this extra money. Please just get me ready for this game. And that was a very strange turn. Whereas I think, like you and Dr. Allen, like for the Spurs, it's a little bit different where like they're taking care of their bodies because their body is the machine, this was very interesting because some of these guys were, insurance salesmen or, lawyers or teachers, and then they're going to play for this basically extra money on weekends and some summer breaks. So it was very different mentality. And it was sometimes hard to switch gears from how I would treat a patient that would be like family and how I would treat this guy who just needs help for this weekend or next weekend or just this season. Like, doc, I just want to get through the season. Like, what do I have to do? Take me up, whatever it is, I will do that. And then off season will treat me, for like one guy had sesamoid fracture. He's like, no, this needs to be like just dealt with. And then I will rest. So that was interesting. It was a mentality change really, because you're going from like textbook and doing everything A, B, C, and D to now, all right, here's reality. Here's reality for this person.
I love the term weekend warrior on steroids.
Yeah.
Is that? I'm sorry, Joe, go ahead.
No, And I appreciate, I actually did not realize that you can appreciate again the difference in the expectations that happens there. And I can imagine in that role, some of the best expertise that you can offer that patient is, look, there are some things that you're right. Okay, we can tape you up. We can put you in a functional orthotic, a shoe, whatever it is, right? We can figure out how to support your injury and get you through a weekend, a season, or whatever. And then there are other things where it's like, look, if you do that, if you sacrifice that now, this is the long-term ramification. Are you willing for this one weekend to do, and like that kind of expertise you can't get through ChatGPT, right? Like that is the kind of thing of why they are really coming to see you. And so even more a highlight for me to hear from you're a professional in terms of helping athletes really look at not just recovery and repair, but also long-term, like when can I run on this injury? When do I need to cut back? And when do I actually need to talk about stop and cross train or whatever this looks like, right? And so that kind of expertise, that's a different framework to kind of even function out of, because we're all so focused on like, this is the injury, we treat the injury. What was that like for you developing that over time?
It really changed my protocols because I think you can get decision fatigue pretty easily, especially early on in your career, because everything feels new. So I had to come up with protocols early. Obviously, I do deviate from time to time, but coming up with protocols just helped eliminate. I didn't have to make so many choices. And I think that was really important for me. Like it has to be pretty, at this point, if you were to come to my office, like I would rest people faster when I was earlier in my career. And now it takes a lot more for me to rest a person. And that's now my new protocol. And that comes from seeing how patients fare mentally from it. So yes, I think it made me more protocol driven, not understanding when my boss would be like, follow the protocols. I'm like, well, I don't think this one works in these situations. I don't think the personality is really that I'm attracting. I don't think it lends itself to that. So it made me really stop and think, as funny as that sounds, I think we're so used to in school and even in residency, like you're used to having the answers. And now all of a sudden you don't have the answers because this is a real human that you have to now follow up on. It's not clinic where I can punch it to my friend next week, but someone you have to keep following and keep dealing with when they're not getting better or they're still hurt. So it helped me to have a stepwise approach and then even educate the patient in my stepwise approach. Hey, I've got you. I've dealt with this before. Now I can say that, over a decade in. I've dealt with this before. These are our steps. If we don't get here by this point, then we're switching to this. So you know that there is a plan, because I think patients just need to know there's a plan, things are expected, that sometimes they're not going to heal right away. So I do always give people the plans B, C, and D. I'm like, you don't have to remember this now, but just know I do have a B, C, and D ready to go should A not work. And I think just the way I educate people has completely changed. I'm not actually sure that was your question, but I think I deviated. I'm sorry. But yeah.
No, that was exactly. And I love that because that fits that partnership idea, even like that's a good theme in this idea that if you have someone you're going to trust to become a partner in your care, you want them to have a plan that's not like, well, we're going to fly by the seat of our pants and see how it goes. But you also want a partner that's not just going to be like, well, this is the plan. We never deviate from the plan, because that's not patient specific either. So I think, and having that kind of expertise crafted over years helps you see, yeah, look, if it doesn't get to this point by here, I can tell you that's when we need to look at plan B, or that's when we pivot and we do X, Y, or Z. Like that's the kind of partner you want to hire, especially if you are an athlete. And that can be a weekend athlete. That could be whatever you identify as an athlete. Like I am not an athlete, but I like to be active. And so I would want a clinician to factor that in. And if I had to like stop all activity, I would want them to tell me that. But if I didn't, I don't want to default just because that's the algorithm that everybody follows. So I love that. I have one more piggyback on that, but Jeff, any other questions before I go to another question?
No, you can go to another one. And I'll come back around.
and it might align with this, but when you think about misconceptions in sports medicine, what do you think is still kind of a common podiatric sports medicine misconception out there?
I think a common misconception is how, use a silly term, but how sexy they think it is. It's really not as cool as it can be. Like, I don't know. You're dealing with smelly feet, people that want to just keep moving. It feels sometimes like a lot of battling. So I think that's a misconception that that it's a lot cooler and glossier than it actually ends up being. But on the turn, I would also say that more people are athletes than you think. So even Joe, you were saying that you're not an athlete. I would just say because you're a mom, you are. You know, it's you have to be so active just to have kids and keep up with them that often that's the person that I'm really gearing my sports medicine expertise to. So it's keeping people moving and keeping them active and keeping them feeling healthy. I can't tell you how many times I'm handing off the tissues because people are in pain and they can't move the way they want to. I literally keep tissues right next to them, and I go through them just as fast as I go through Band-Aids and KT tape. So it's just so interesting how tied to emotion. Yeah, I guess that's really the misconception I would definitely highlight and underscore is how emotional sports medicine is and how emotional it is for that athlete in the chair. And it's not just cut and dry because it's sports. It is so emotional and so identity driven because most of these people tie their identities so much to their movement and the way they can move. So yes, I think that is a huge misconception is how emotional it is.
Oh, I love that.
I like that too, Joe. We used to have a saying that we're all athletes. It's just some of us are in training and some of us aren't. So,
I like that.
And so like for an example, you can treat a marathoner 1 minute who's got a stress fracture or a pending stress fracture. And then the next patient comes in and they're just trying to walk a couple miles to lose weight. They take it just as serious. And to your point, they identify with their ability to move and help them in their wherever they're at in their life or their goals or their expectations. So I love what you're saying. It's very emotional.
Yeah.
Oh, this is such a I did not expect to go here at all, but this is such a great conversation because certainly the thing that surprised me most about clinical practice was exactly that. How much also permission people needed, like just the fact of having a tissue in the room and just handing them a box. It allows them the moment of like, it's okay to tell me all the things that are surrounding why you came in today. We recently I had a musculoskeletal fellow with me. She's looking at like neuromuscular medicine. And anyway, we had a patient that came in with a condition, and really what she needed in that moment was information about the condition. Of course, that's the very practical reason of why she was there. But there was so much additional information layered on top of that that was important to have as part of the discussion, especially if she went down something like a surgical road, which was not really where the discussion was focused. But certainly to your point of like you're in residency and so much of it is procedure, indications, contraindications, how you do it technically. What is left out in that is how much communication matters in expectations surrounding recovery, what this is really going to look like for you. And again, it's not to say don't do it, but if you're having a conversation with someone and they are a caregiver and a mother and or whatever, right? They have all of these additional things that also come with them that are inseparable from this other condition. And I'm going to take your leg away basically for 6 to 9 months if I'm going to do, like that's a big deal. Like, let's just realistically talk about what this looks like. And that's not to say don't do it, but it's to say, let us set you up for success and figure out how this might look. And in the meantime, while we get there, let's start doing these things. And that conversation is not a 10-minute, right? Like the way that we book some of these things. And so that emotional part of what we do is so important in the communication. And I would argue that it's just as important as whatever your outcomes are, because your outcomes are going to be impacted by all of those things that the patient is going through. My favorite quote, Jeff, from Dr. Hanf, right, is If you want to know why patients are non-compliant, ask them about their life. Like, what are they actually doing? And what do they have to do that you just don't even know, right? Like, so much of my own growth was just asking, help me understand why you're not doing this. And then you hear and you're like, well, holy cow, no wonder you're not able to stay off of, like, I understand. I would have a hard time with that too. Let us figure out how to partner together so that we can give you the tools for success. What can I order for you? Guess what? There's a whole thing of durable medical equipment. Maybe we need to look into this together. Maybe you need a note for work, right? Like, those are not parts that someone's going to come in with their multiple choice. Like, these are the things I need from you today. But they're such an important part of what we do. So I appreciate that you brought that up, because again, it's another one that I don't think I personally identified, but definitely have carried as like one of the most important things that we do as we're treating patients, is treating all of the things that they're coming with.
I have a question for Elizabeth. I agree with you, Joe, completely. What percentage, a two-part question, what percent of your patients from a sports medicine background are acute injuries versus overuse injuries, biomechanical injuries? Is that a fair question? And then the second part of it is, which is easier to treat?
Yeah, it's funny you're saying that, because I expected a lot more acute injuries, but I think because opening up my own thing about 4 years ago, I was sort of the new kid in town, and so I did get a lot of chronic issues. Also, I think people just assume foot pain's going to go away, or they want to ignore it. So I definitely find acute injuries are easier to deal with, because just a broken bone is pretty clear cut, no pun intended. But I find, or even an acute ankle sprain, something like that. But I find that chronic ones are difficult because there's often so much compensation that then you're dealing with, and I always liken it to whack-a-mole. So, okay, now this doesn't hurt, but now this does. And I'm wondering if this pain then masked that pain, and what is it you compensating now? Is it you compensating because now I have food, or just figuring that after? I find that the symptoms for some of those chronic issues become like whack-a-mole. Or even, I don't know if you guys use shockwave. Sometimes if you're using shockwave and you get rid of the pain in one spot, and they're like, actually, this spot erupted in pain, and can you just also hit here? So it's just, I find it, the chronic issues more like whack-a-mole sometimes. I don't know if you've ever played that game, the arcade.
Yeah. Oh, yeah.
Yeah.
That's interesting. Speaking of sports medicine docs, Dr. Jim Lucido down in Miami, he's the heat doc. And Celia, my wife, had heel pain, and it was just recalcitrant heel pain, injections, orthotics, you name it. She didn't want to have surgery, but Jim Lucido did shockwave therapy for her. And it worked. It worked. It was a miracle. Really good.
Yeah, it makes it, for me, it was finally, for those recalcitrant heel pains, which I was getting a lot of. And it just felt like I was treating it with one hand tied behind my back. So this was a new thing I got a year ago, and I just found it to be so helpful, because it can even just help you find where the pain really is. So yeah, I'm glad your wife had success with it, because I've been finding it game changing for me.
Joe, I have one more question, if I may.
Yeah.
So, Liz, what are some new technologies coming out that are going to help our patients that have in the past been extremely challenging?
I do love all the regenerative medicine out there. And if that's what you're talking about, then yes, I am so thrilled about it. I'm really excited about the new biologics out there. Like I said, I think I told Joe, but not you, Jeff. I'm going to go fully non-surgical. I finally, after 2 years of hemming and hawing, not really doing that much surgery, I was like, this is just my way. But really leaning into the regenerative medicine has been tremendous. All the nutrition research out there has been amazing. I think AI is going to help us in ways that we don't realize yet. So that's kind of exciting. I really want to look into gamifying some of my protocols, for patients, for their stretching and all of that. So I would like to see how that technologically, how I could even achieve that. But yes, I think the regenerative medicine stuff, and people just wanting to have their own bodies heal themselves instead of going, so pharmaceutical based. I think that would be really exciting. Instead of, popping pills or even cortisone, let's see how my body can heal itself just from all the research that's out there, whether it's new exercises, new technologies with, I think the biologics and even the red light therapy is really exciting. It's showing some real promise. So something the patients can actually take home and use every single day to help speed up their recovery. All of that sort of stuff. For me, I find it fascinating and I'm ready to jump in head first, but sometimes I have to tell myself, just wait, let's just see. Let's just see what happens. Let's see what other people are doing. Yeah. Because otherwise I'm like, yes, sign me up. Let's do that.
Something, I think what you said about gamifying things is so important because it makes treatment fun. The patient doesn't even realize it. They've gamified meditation. They've gamified tonal for weightlifting. They've gamified everything so that you can track yourself and feel good about yourself and enhances compliance. I mean, there's all kinds of good things with gamifying. Joe, we've talked about this a little bit. Anything that gets people's attention and keeps them on a straight and narrow is good.
Yeah. I've got to
and no, go ahead.
No, that was it. I just want to say I've got to incorporate it better.
Yeah,
Well,
like
maybe
having a
invent it.
metric there that like you get to see what your progress is. And then like the day you don't do it, you're like, oh, it's a gap. Like we all respond to that. So, and when it makes it more enjoyable, I think it's fair to say most people would rather do something that's enjoyable than not. So I think there's definitely an upside to how it engages people maybe in a way that they feel more connected to it. Even if we have to kind of like play a game to trick them into it, like that's okay. Like trick me all day long as I don't miss my week streak on my Peloton. Like I'm a happy girl, right? But as soon as I miss it, I'm like, oh, I have to start all over,
Yeah.
So yeah, I'm prey.
What a statement that is. We're all like that, right? I mean,
Yeah.
Psychologically, we want to, feel good, and God forbid you miss a day of meditation when you've got 200 in a row, right? So you don't.
Yeah.
What a killer. I know.
Yeah.
I love it. Joe, where else were we going here? Because we got to save a little bit of time for some rapid fire.
I know this is what it happens all the time. I could seriously talk to you for like a couple hours, Liz. I do want to just briefly talk about AAWP. We'll start with, I'm going to throw the ball to you and let you talk about how it's impacted your career and maybe what some of your most exciting initiatives or thoughts are in that space.
Oh, okay. So Dr. Langone, who I'd worked for, was the one, I don't want to say suckered me onto the board, but, I'd been involved before, but she said, no, it's time. You can do this. And my first meeting actually was when I was in the delivery room for my second child. So that was pretty funny. But what was amazing about it is because I went down to part-time just because that's what worked for my family when my kids were born. And it wasn't someone being so career centered. It was very surprising how much I wanted to be a mom when my kids were actually here, once they weren't a concept and they were actually in front of me and you fall in love with them. So that's where I think AWP kept me, I don't want to say relevant, but kept me in the swing of things. I got to learn things from these women who had done it before. And even someone taking sort of a non-linear pathway, I was able to go to APMA National and meet all these amazing people and almost have like relevance because of AWP and say, hey, I'm on the board of AWP. It's nice to meet you and be able to meet some incredible people, get to be on podcasts like yours, but even like Podiatry Today and write articles just for being on AWP gave me a spotlight for someone that really probably wouldn't have had it because of having to go part-time for my kids or wanting to go part-time. So it really just opened up some amazing doors and I've met some incredible people and the camaraderie in that group has just been so surprising and just wonderful. And I absolutely love it. It's a group that I didn't think would benefit me as much as it did. I thought, they need me, my ego. But I can't believe how much I've gotten out of it. One of the initiatives I had started was a mentorship program, but that kind of fizzled because you were losing a lot of people in the residency realm. And I found that a lot of students want residents as mentors. They didn't really want the seasoned practitioners. It was the residents wanted the seasoned practitioners, but we lost, the ground with the residents. And I think a lot of organizations have that. But I think the best thing that we do really is our conference, because it's so intimate. It's probably only 60 people, but it was like the one conference that everyone felt comfortable asking questions. And sometimes you go to these big conferences and people ask questions with a brag. I don't know if you noticed, like, let me tell you about how great I am, and then I'll ask my question. There was no pretense. As someone that you'd be surprised to see, like, I'm on the shyer side. So to be able to go up to the lecturers and just ask them questions was out of my comfort zone, 100%. But at this conference, because it's so small and you're seeing people all around, it just gave you the comfort with these experts. And I learned so much, not just from the lectures, but just from the chatting in the lunch line or, in the exhibit hall and all this. So it's just, I think that's our best thing, honestly, besides the webinars and all the scholarships and all that stuff that we do. I think our conference is just unbelievable gathering, camaraderie. It makes you so excited to be a podiatrist again, because sometimes you need that, right? You need those things that just get you excited. And I love podiatry. I know not everyone can get that excitement from their job, but it's just so fun to be around people that are excited about your job, about what they do, getting people moving. And it was just one of those energy boosters. I call it a battery charge. It was just such a battery charge. These people that, there's certain people that drain your battery. These people that are part of AAWP always seem to charge my battery every time I talk to them.
Oh, I love that. I think, Jeff, we're going to have a separate one, because there's like a whole chunk we didn't even make it to. And some of it can be even more AAW, maybe in preparation for the meeting that's coming up October, correct?
Yes. Yeah, that'd be great.
Yeah. So maybe we'll do a plug for the meeting, and we'll do another episode.
And one of the cool things about AAWP, and this is back when I was in Miami at Barry, the meeting was in Miami, and they asked me if I'd come and give a talk. I said, "Really? Are you sure?" Like, because
Yeah, you're thinking it's just for women. No, it's for women podiatrists, not just women podiatrists. I always
it was great.
I'm glad.
Yeah, it's not exclusive; it's inclusive.
Yeah.
Right.
Yeah.
Very good. All right, Joe. Let's do some rapid fire.
All right. Strangest food you have ever eaten?
Oh my. Probably fermented soybeans. Japan.
Oh yeah.
The toughest environment to play lacrosse?
Denver. It was really hard to breathe.
Oh, very good.
Favorite place that you've traveled and why?
Oh, definitely Japan. It was incredible. Again, with lacrosse, we got to play at the base of Mount Fuji. But the referees were absolutely amazing, which sounds funny because we couldn't understand them. But it was just growing up in New York, you're used to like dirty areas. The subways were so insanely clean. And as someone that didn't speak the language, I could navigate their whole metro system seamlessly. It was unbelievable. So I would say Japan's Tokyo specifically.
Oh, I like that. How about going on vacation with the kids? Mountains or beaches?
Ooh.
Or neither?
Neither. I don't know. We don't vacation.
Well, that's a stage of life, I think.
Yeah, we live right by the beach, so I'm going to say beach.
All right, very good.
If you could invite anyone to dinner from any time period in history, could be famous or not, who would it be and why?
Oh, I like this question. Just because we talked about him earlier, I'm going to say Mark Twain. He seems hilarious and very interesting, so I'm going to go with Mark Twain. I'm sure there's one
incredible dinner.
Yeah, I think he would be fun. Get a couple drinks in him. He'd be fun. Yeah. I don't know if he wants to.
How about food of choice?
Yeah, New York pizza can't be beat.
I thought you were going to go sushi from your Japan trip.
Yeah, no, yeah, I know. I should have, but no, I'm going to stick with New York pizza.
Oh, I like that. Good
idea. We got time for one more?
One more.
All right. Are you a dessert or a cocktails person?
Oh, dessert, 100%.
All right. Favorite dessert?
Oh my goodness. Everything. Can I say everything? Yeah. Let me say everything, but I love anything with raspberry and chocolate. I'm going to say that.
All right.
Oh, I love that.
Made it less rapid than.
You know what we need to do? It doesn't have to be necessarily a part 2, but like you said, as the AAWP meeting gets closer, we'll put it together. Liz, thank you so much for taking the time to join us on Dean's Chat today.
Thanks for having me. This is so fun. I really appreciate you taking the time. Like I said, all you've done for our profession.
And likewise. And to all of our listeners out there, if you're on Apple or Spotify, please give us a 5-star rating or leave a comment or two. And if you're watching on YouTube, by all means, become a subscriber. Joe and I will continue to bring leaders in podiatric medicine like Dr. Piselli. And we look forward to seeing you next week. Bye, everybody. Bye. Oh, shoot.
It's all right.
Dean's Chat
We'll
mug.
send you a mug.
Heading your way, Elizabeth.
Oh, that's so exciting.
Yep. And then you can put like hot chocolate and raspberries in.
Yeah. Or my, yeah.
Or other things. All right. Bye-bye. Bye, everybody.